Pharmacokinetics studies what the body does to the drug when it can absorb, distribute, metabolize, and eliminate the drug. Pharmacokinetics is all about absorption, distribution, metabolism, and elimination of the drug. Drugs can be administered by enteral and parenteral routes. The enteral route involves the digestive system. Examples are PO, rectal, and giving the drug by the nasogastric tube. Parenteral administration will bypass the digestive system. Examples are IV, intramuscularly, subcutaneously, or giving the drug by inhalation. Absorption depends on the route of the administration, an environment, and the chemical characteristics of the drug. One important characteristic is solubility. It's the ability of the drug to move across the lipid membranes. Drugs have small or large molecular weight. Small molecular weight drugs are more likely to cross the lipid membranes than the large ones. Drugs are either a weak acid or a weak base, and they exist in charged or uncharged form. The drug's ionization depends on the environment's pH and the pKa. A pKa is the pH at which the drug is 50% ionized and 50% non-ionized. The environment where absorbed drug exists is mostly composed of water. A water molecule is composed of 2 hydrogen and 1 oxygen atom. Oxygen has 8 positively charged protons, and the core of the oxygen attracts the negatively charged electrons from the hydrogen and tilts them slightly to the oxygen side. That's why it becomes relatively positively charged on the hydrogen side and negatively charged on the oxygen side. This negative charge comes from the attracting the electrons. We can simplify this and say that the water molecule is a dipole, charged positively at one side and negatively at another. Water molecules are held together by the hydrogen bonds. As we understand that the water is a dipole, it's easy for us to imagine how drugs can be water-soluble. Take a look. Charged or ionized drugs are held between the water molecules. They are water-soluble, whereas uncharged or non-ionized drugs can easily cross the lipid membranes. To summarize, ionized or charged drugs are water-soluble. Non-ionized or uncharged drugs are lipid-soluble. Drugs can be either a weak acid or a weak base, and they exist in ionized or non-ionized form. Examples of the weak acids are aspirin, also known as acetylsalicylic acid, paracetamol, penicillin, etc. They contain a carboxylic acid group which acts as the donor of the protons. Letter A here represents a weak acid. Only the protonated form of the weak acid is non-ionized and can cross the membrane, whereas the ionized form of the weak acid is charged, water-soluble, and cannot cross the membrane. On the other hand, weak bases contain a basic amine group that can accept the proton. Examples of the weak bases are atropine, amphetamine, local anesthetics such as lidocaine, cocaine, etc. A protonated form of the weak base is ionized. When it loses a proton, it becomes non-ionized. A non-ionized form can cross the plasma membrane. To summarize, unprotonated form of any drug can cross the membrane and is easily absorbed. A protonated form of the drug cannot cross the membrane. It's water-soluble and eliminated easily by the kidney. pH stands for the potentia hydrogeni in Latin. It means potency of the hydrogen. More hydrogen you have, more acidic is the environment, and the pH will be low. pH in the stomach ranges from 1.5 to 3.5. It's highly acidic. In an acidic environment like in the stomach, weak acids are non-ionized and are easily absorbed because they cross the membranes. For example, aspirin is acetylsalicylic acid. It's non-ionized in the acidic environment. It becomes lipid-soluble and absorbed easily in the stomach. In acidic environment, weak bases are ionized. They do not cross the membrane and are not absorbed easily. But in the alkaline environment of the small intestine, weak bases lose hydrogen and become non-ionized. They become lipid-soluble and are easily absorbed in the alkaline environment, whereas weak acids are ionized, charged, and cannot be easily absorbed in the alkaline environment of the small intestine. To summarize, the drug will become more lipid-soluble in a solution similar to its own pH. Weak acids are lipid-soluble in acidic environment, and weak bases are lipid-soluble in alkaline environment. Please remember that most of the drugs are absorbed in the small intestine due to large surface area. Ionization can increase renal clearance of the drug. This picture represents a kidney tubule. Red color represents blood vessels. These blue cells are epithelial cells and yellow color represents urine. Like other substances, drugs can be filtered and then reabsorbed. The pH of the tubular lumen can change the ionization of the drug and by this way can change its absorption or elimination. Normally, proteins such as albumin and globulin do not cross the filtration membrane due to their large size. Though protein-bound drugs are not filtered, only free protein-unbound drugs are filtered. Non-ionized drugs can cross the epithelial membranes and are easily absorbed. The ionized form of the drug cannot cross the tubular membranes and are eliminated easily by the urine. Understanding ionization will definitely benefit your patient in case of drug overdose. In case of drug toxicity, you can increase urinary excretion of drugs by just changing the pH of the urine. As we defined, ionized drugs cannot cross the tubular membrane and are not absorbed. You can change the urinary pH toward more acidic and increase the ionization of weak bases. This will increase the elimination of the weak bases. You can achieve this effect by giving weak acids such as ammonium chloride and vitamin C, also known as ascorbic acid. This is called urinary acidification. It was widely used in the past to treat overdoses of weak bases, such as amphetamines, quinidine, phencyclidine, because we don't have antidotes of these drugs. However, this practice has been abandoned because of the iatrogenic toxicity of severe metabolic acidosis after giving acidic chemicals. On the other hand, if you give sodium bicarbonate or acetazolamide, you can make urinary pH more alkaline. This will increase the ionization and therefore elimination of the weak acids. This is called urinary alkalinization. It's the method that we still use in case of the weak acid poisoning, such as aspirin or phenobarbital, because we don't have antidotes for these drugs. Rising the pH from 7.5 to 8 will increase the ionization and excretion of the weak acids. A goal of urinary alkalinization is to achieve the urinary pH greater than 7.5 or even higher while maintaining serum pH from 7.5 to 7.6. This is done by giving sodium bicarbonate intravenously. This is the most effective treatment nowadays after hemodialysis in case of aspirin poisoning. To summarize, changing the pH of the urine will convert the lipid-soluble acid or a base into a charged solid. A charged particle is water-soluble and cannot move back across the renal epithelium. This leads to entrapment of the drug in the renal tubule and increase in drug excretion.